Thank you for joining us today. I'm Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Before we start, we received a question regarding Health Unit services. The Health Unit continues to provide limited services at this time, including emergency dental treatment, phone and virtual support for new moms, and public health inspections. Please call the Health Unit or visit our website if you have a question about our services at this time. I will now share our daily updates. We now have 9,613 confirmed cases of COVID-19 in Canada and 2,392 cases in Ontario. Chatham-Kent has 8 cases and Sarnia-Lambton has reported 56 cases. Michigan now has 9,334 cases with 2,472 cases in Detroit. We now have 128 confirmed cases of COVID-19 in Windsor-Essex, and we now have 3 COVID-19 outbreaks in long-term care homes. 27% of our cases are in the 50 to 59-year age group, 45% are male, and 55% are female. The Health Unit follows up directly with everyone who has tested for COVID-19, both positive and negative tests. Those that are awaiting results are to remain in self-isolation. If you have tested negative for COVID-19, you must remain in self-isolation for the remainder of the 14 days. Overall, 1,237 individuals have been tested for COVID-19, and of those tested, 268 tests are pending. Testing for COVID-19 should be based on clinical assessment. Where there are shortages of testing kits, and the following groups will be prioritized: symptomatic healthcare workers and staff who work in health facilities, symptomatic residents and staff in long-term care facilities and retirement homes, hospitalized patients admitted with respiratory symptoms, symptomatic members of remote, isolated rural and/or Indigenous communities, symptomatic travelers identified at a point of entry to Canada. Please continue to visit WECHU.org for the most current information and case counts. Many of our frequently asked questions are posted on our website. If you are feeling unwell and need to seek a health assessment for COVID-19, there are 3 options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone assessment or a virtual assessment if available. They will guide you for next steps, including contacting public health or attending an assessment center. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. This week we have seen the number of cases past 100 in our community, including confirmed outbreaks in the long-term care home. This is now shifting our attention towards the most vulnerable in our community who are living with chronic conditions. The ministry has provided guidance to long-term care homes around COVID-19, starting from preventing the introduction of COVID-19 into the long-term care home and associated preparedness measures to when a long-term care home is under an outbreak. Some of these measures include active screening of staff. So staff who are working there, their twice daily screening, including temperature checks, should happen. Active screening of all residents twice daily, and all new admissions arriving from community are placed in isolation for 14 days to protect others. Changes to the outbreak case definition in this long-term care home, which now includes only 1 case in staff or resident, is now considered as an outbreak. Homes that are currently in outbreak and staff providing care with high-risk exposure should not work in any other homes and facilities. Given the high number of COVID cases in our community and the potential delay in getting some of these results back, we must prioritize these testing for those individuals where having a positive diagnosis will have an impact on their clinical outcome. The priority groups, which Theresa just mentioned, including inpatients, ICU patients, long-term care home residents, healthcare workers. The likelihood that someone who developed a respiratory symptom that is a new onset of cough and fever in our community to have COVID-19 at this point is very high, given the high number of pre-test availability probability for anyone in our community. At this stage, if you are someone who thinks that you have COVID-19, please contact your healthcare provider for a telemedicine assessment. Our primary care group colleagues have really worked hard to arrange telemedicine consult for most of their patients. Your doctor can make a determination if you need testing or if your symptoms worsen and may direct you to the hospital or the assessment center. It is important to note that almost 80% of the individuals with mild symptoms will not require any treatment and will recover on their own. Anticipating the surge of cases in our community, we want to utilize our healthcare resources wisely to care for the sick who need hospital care or more intensive care. I continue to urge you, please do not go outside if you don't have to. If you do go outside, please maintain a distance of 2 meters from each other. People who are asked to self-isolate, they must self-isolate for 14 days or until the time when when public health asks you to come out of the isolation. Look after your family members, look after your neighbor, support them while still maintaining the 2 meters distance. People who are not sick and do not have any symptoms, stay home, spend time with family, do not meet anyone who doesn't live with you, and break the chain of transmission by not contracting the disease in the first place and then not spreading it to the other. Please be safe, do your part in protecting your community, break the chain of transmission. Thank you.
We'll now take questions from the media. We'll start with KMA 100.
You mentioned a third outbreak at a long-term care home. The other two were in staff. What can you tell me about the third long-term care home that's been infected?
So right now we're
patient.
It is a staff, and our team is getting in touch with them to go through all these enhanced procedures that they have to follow through to further enhance their outbreak control measures.
Which long-term care home is it?
I will have to. I think it's the Riverside. Sorry, we'll post the details. We'll post the details on our.
Sure.
I'll have to check with my team. My team is just looking for it, so just bear with me.
Okay, no problem.
Okay.
Okay. Yeah, BTV?
I don't know what workers are wearing, but I know there's a concern within the workforce among the PSWs. So will you enforce them wearing protective gear, much like the frontline health workers are doing right now?
So your question is if they're not wearing and we will force them?
I don't know if they are, but if they aren't, will you put measures in place for them to wear, like, a full mask or whatever, just to protect? Because obviously a 2-meter rule can't apply with, their business, right?
So most of these guidelines are already out there, and the workers who are working in those areas, such as long-term care home, retirement home, and who are in the hospitals, they must follow those guidelines as recommended. All the type of personal protective equipment that they need to control to do their work, it should be available, and they should be following that.
Follow-up question. Windsor Star?
Hi, Dr. Ahmed. You referred to these positive cases at long-term care homes as outbreaks. Is it only staff members who have tested positive, or are there also residents who have tested positive?
So I believe there are residents who are currently being investigated right now, and we're waiting for some of the results on those symptomatic patients. But typically, what happens in a home, if we know that there is a respiratory symptoms or someone who has an infection, the likelihood of others contracting it is much higher than in the community. So right now, we are treating it as an outbreak that is spread in that long-term care home. All those controlled measures that we are trying to put is to ensure that we can contain it, and we identify those individuals who have any symptoms, and using all those personal protective equipment, using all those techniques that we typically use in managing these outbreaks. If we do it right, then we are able to limit and contain the outbreak as quickly as possible.
The previous release from the health unit indicating the 2 long-term care facilities from yesterday, one of them is referred to as Amica. Is that Amica Riverside in Windsor?
Amica, yes, Amica.
And have you disclosed the name of the third facility?
My staff is just checking in to make sure. We just become aware of it, so we just want to make sure that I'm not giving the wrong information. So you will know before we finish today's event.
Thank you.
Any questions from Windsor-Essex.ca?
Yesterday, the health unit said that they had notified staff and residents from the long-term care homes. And we've heard from a number of readers who've said that that is not the case and that residents and staff did not know actually about this. What's being done to actually notify residents and staff in the future for outbreaks?
So when the outbreak is declared, there are a number of measures that start to happen, and most importantly, the part is how do we put control measures in place to prevent further spread, identifying those who are sick and putting them, or the term we use is cohorting them in ways by applying all those personal protective equipment, putting them in isolation whenever it's possible, keeping all those physical distancing measures to ensure the safety of each of those residents. So those are the priorities, and everyone is involved and engaged in that. Our health inspectors go to these facilities. They provide support to these facilities in ensuring that all those infection prevention and control measures are in place, and we continue to provide support to them. When you're talking about who is aware, who's not aware, so the homes usually take the lead in informing the family and the people who are who have their loved ones in the facility, and they do it in a timely manner. I cannot comment on it, but I think from a public health perspective, our priority is to make sure that measures are in place to protect the residents and the staff from spreading it and containing the disease as much as possible.
Any follow-up?
Okay, so the notification to residents and staff, that's something that's done by the homes themselves, or is that something that's done by the health unit?
Historically, that's done by the homes to the I guess to the staff or whoever is involved. We take the lead in ensuring that the safety of the residents and the staff is in place, and identifying who is classified as close contacts and what the recommendations for them, and others who may have been in contact but do not qualify as close contacts, and the recommendations for those individuals. So we do work with them, but most of these activities are identified when we start the investigation and collect all that information. So just to follow up on the last question, so the third facility name is Lifetimes at Riverside.
Any questions from? Oh, sorry, go ahead.
It's Life on Riverside Drive or Lifetime at Riverside?
Lifetimes Riverside. So I that's all I know.
Okay, thank you.
Okay. On Riverside, yes.
Lifetime on Riverside.
On Riverside.
Any questions from CDC?
Yes, I have a question about people who might not be self-isolating after coming back from a trip. We've been getting questions about who should people call. We've been seeing that Chatham Kent has set up a phone line, same with London. Are there any plans to set up, I hate to use the term snitch line, so to speak, here for Windsor?
Well, we're looking at it, and we're learning from other jurisdictions as well. There has to be some balance in terms of taking up some of those responsibilities at every level. We do want people to follow those recommendations very seriously. We don't want to get into the position where we start issuing orders to those individuals, and we will if we have if we make that determination that someone is not following the self-isolation as they should, we will issue an order that will force them to stay at home or face the penalties that comes with those order. So we want people to take it seriously. This is not a joke. People are dying, and people will die. We need to take it seriously. We recognize that if you need to go outside, you can, but people who are told to self-isolate, they must self-isolate. There is no option for them. They have to make arrangements for others to drop those essentials if they need, but they have to self-isolate. They must self-isolate.
So what should people do? Who should they call if they do see something?
Well, they can call the health unit just to give us information, and we will try our best to try and get that information. But practically, like if we are getting hundreds of calls, it's even hard for us to even say that what's the mechanism in place to identify that those are the right people who we asked to self-isolate. It has to go through all those confidentiality and ensuring the privacy of some of those individuals. So we will look into it. I cannot say that this would be a best system to use that line and to start enforcing that. But those individuals who we are following right now, or our team is following right now, if we have any evidence that those are the individuals, if they are not following some of those recommendations, we will be taking actions, and we will be putting strong measures in place to make sure that these people are following the recommendations of public health.
Thank you.
Any questions from Blackburn?
Yeah, the staff that are working at these 3 outbreak facilities, the facilities where those 3 outbreaks are, what are they told when they're going home? Are they told to self-isolate in between shifts?
Well, it really depends on the type of exposures that they're having. I think as a general message, if you are a staff worker who's working there, you try your best not to expose yourself to other individuals, because there may be a delay when you start to show symptom and you actually become positive, and there is this delay could potentially, there's a possibility that you may spread it to others while you are still in that pre-symptomatic phase. So taking precaution is important, but something that is recommended by health unit would be those who are in close contact with some of those people who are identified as positive, and when they're going home, they are following some of those work self-isolation type protocol, which makes them going home and taking care of self-isolating themselves, even with their family, and also when they're going outside. So I think there are two types of categories, what we can say. Some, those are as close contacts, or those who work directly with those patients, and then the others who may not directly work with those patients. So we have that conversation with the long-term care homes, and we make those recommendations directly.
Any other questions?
I have one. The number, it appears the number of results coming back is coming back at a faster pace. So the jump that we're seeing, because we had 44 at the beginning of the week, now we're at 128, is this the result of the people who are being tested in the last few days, or is it tests that are coming back from a couple of weeks ago?
So that's a very good question, and so we have done some analysis, preliminary analysis, and we will probably share some of those details tomorrow, because that was the question that was in my mind as well, that what is happening right now, and is this an indication that something is happening as we are talking, or maybe some of these testing were done in the last week, and now we are just getting the results back. So we have done some preliminary analysis, and we should be able to share those details, I'm hoping tomorrow, and that will give us a better picture. But most of these test results that we are getting, these are all old results that were pending. Some of them are new because of if they are a high priority group, such as a resident of a long-term care home, or a staff healthcare worker, or anyone who is in the hospital. So we are getting those results very quickly. But for other community results, there is a delay, and we will be able to share some of those details tomorrow.
Thank you.
Any other questions?
I have a question to follow up on that. I guess I'm just wondering, now that we are able to test people more rapidly, are you expanding the criteria even further? Are you able to test people who you were turning away before?
In fact, what we are saying is most people who will have these symptoms, if they have mild symptoms, so we may not offer testing to them, just for the sake of keeping our labs ready to take care of the really sick and vulnerable, even though we have the testing capacity increase, but the number of people who are sick right now and number of people who are hospitalized is increasing at a very rapid rate. The number of people who are in the long-term care homes, all those numbers are going up, and it's not just in our community, it's everywhere. So we have to take a little bit more caution when we are talking about our healthcare resources, that how we can best utilize it. As an individual, yes, I may be very interested in what my test results mean to me, but from a clinical perspective, if I have mild symptoms, it really doesn't matter if I get a test and if I'm told that I'm positive. What matters is what actions you are taking. The moment you have symptoms, you must immediately start self-isolation to protect yourself from infecting even your family members or infecting your community. And the likelihood of you going through all these assessments, going out and getting the test done when your symptoms are mild, it's not going to change any of the clinical determination. It may make a difference for you, but it may not make a difference from a clinical management perspective and from a population health perspective. So we are reviewing those criteria. The London lab that have a quick turnaround time, they are recommending some of these criteria, and some of these are driven by them, which is based on the evidence, based on the epidemiology. And we want to use those tests, the quick test for those who are really sick, and having a diagnosis could make a difference in terms of the clinical management of those cases.
Okay, thank you very much.
Dr. Ahmed, I just wanted to confirm something. On your website, it says 129 confirmed cases. Was it 128 before, or? I just wanted to confirm the number.
The correct number is 128.
Okay, just wanted to make sure. Your website says 129.
Okay,
We'll
so we'll correct that.
Okay, thank you.
I have one further question. How many are currently in hospital right now, and do you have any numbers on if people have recovered from some of the earlier cases?
So some of these cases we have received late last night and some early in the morning. We will be investigating on that, and then we will be able to share that information.
There's no more questions. Thank you, everyone.
Thank you.
Thank you.
Thank you.